we're going to switch right over to a video from Dr. Tarang Patel, who is also known as Dr. Money Matters. So he's a radiologist. In my background is that I first actually learned about private equity through Dr. Patel's podcast. When I say private equity, learned about private equity getting involved in medical practices through his Dr. Money Matters podcast. And part of my journey here was just taking control of my own personal finances so that I would not be honestly silenced by corporations. When you're under the thumb of corporations and you have several $100,000 in debt, it's really hard to speak out. And so Dr. Patel, white coat investor as well, physician on fire, these were all very important pieces to my journey. But Dr. Patel is working today. He's in and out of this chat, but was great, awesome, and recorded the video for us to give a background on how private equity is really taking control of his specialty as well. It probably started in emergency medicine, but it's expanding quite a bit, and we need really a coalition to take it back.
Hello, my name is Tarang Patel. I'm a radiologist from Phoenix, Arizona. I host the Dr. Money Matters podcast. It's a financial podcast for physicians where we talk about topics in finances that were never covered in medical school. It's an episode that I did on private equity in medicine, specifically radiology. It was one of the places where one of the organizers of this conference, Mitch Lee, was first exposed. He told me to this topic, and it really opened his eyes. It opened my eyes when I did the podcast. And that was in 2018. And as we all know, the private equity's role in medicine and in buying up practices has only increased. So today I'm going to talk a little bit about private equity and radiology overview. So brief history. Radiology was actually first corporatized in the 90s in Australia, following the field of pathology, which had undergone the same thing a little bit earlier. And in Australia, by 2000, approximately the majority of small radiology practices, about 10% of all practices, were corporatized. And by 2005, approximately 70% of these practices had been, all practices in Australia had been bought out. It's gone through some cycles, and it's still heavily corporate in Australia, but things have changed a little bit since then. A letter written by a radiologist in Australia, Dr. Adam Steinberg, to the Australian New Zealand Radiology Society was warning his colleagues that we are the new pariahs of the medical fraternity, pseudo quasi businessmen masquerading as doctors and seen as completely money oriented, happy, willing, and seeking to sell ourselves, our services, and our souls to the highest bidder. And I think that many of you attending this conference can kind of see some of that happening in US healthcare. I don't blame anyone for selling to private equity, because you have to do what's financially right for you and your family and your circumstances. But we also know where this is going to lead for patients, for the next generation of physicians. And it's probably not going to be good. That's my opinion. So in the US, the first deals in radiology were starting in the mid 2000s. And they started with the teleradiology space. Nighthawk Radiology was one of the early large entities in teleradiology, and they had an IPO in 2005. They were followed rapidly by VRAD, who many of you may be familiar with. In 2006, VRAD was subsequently IPO'd in 2006, subsequently taken private in 2010 by private equity for a pretty large amount. The IPO was 75 million, bought out by private equity for almost 300 million. With that funding, they were able to buy out Nighthawk and merge and create a large teleradiology firm, which was then themselves bought out by Mednax, who many of you may be familiar with their, who is a large Wall Street entity that owns practices in anesthesia, pediatrics, and this was their entrance into radiology by buying out VRAD for a $500 million deal. That entity had its ups and downs. They also bought some other practices, traditional practices, private practices along the way. But during the COVID financial issues, crisis, they had some difficulty, and they themselves then sold their entire radiology division to Radiology Partners, which is currently the largest PE group, radiology group in the US, including VRAD, for what's estimated about a $900 million value. The deal was not made fully public. So currently in the radiology space in the US, Radiology Partners, who I just mentioned, is the largest entrant or member of that field. They have approximately 2,800 radiologists. They're funded by multiple investment entities, including one of their original ones, New Era Enterprises, who themselves have funding from the Australian National Pension. So they probably have some experience with corporate radiology. Rad Partners is led by former executives from DaVita, the dialysis company, who many of you have probably read about recently having their issues with the government regarding their practices. And it wouldn't be surprising to hear that they're going to now be involved in, their executives are involved in corporatized medicine. Envision Health is another big player. They were publicly traded. They've also had many entities, including, I believe, emergency medicine and anesthesia. They were public, and then they've taken private, I think last year or 2 years ago, by KKR, which is a large investment conglomerate. Some of the other players in private equity radiology are US Radiology, Lucid Radiology, Foundation Radiology. These are predominantly hospital-based and traditional private practice groups. There's also the outpatient radiology sector, which are some of the big imaging centers that you may be familiar with. If you're in the West Coast, Simon Med is a large outpatient imaging center here in Arizona and California. And then also across the nation, RadNet, which is a publicly traded firm that focuses on outpatient imaging. Simon Med is a private entity, but there's been some articles talking about they're looking at external private equity funding. Currently, the US radiology corporate market is still not large, so there's expected to be more deals happening. I think the total number of US radiologists are actively practicing are under 40,000, and maybe 10% of those, maybe 12% of those are employed or work for a corporate entity. So there's still more market share for these groups to have, provided they have enough funding. And as of now, they don't seem to be slowing down in their deal making. So the future of radiology, there's a couple of ways to look at it: pessimistic, optimistic. I'll go with the pessimistic first. That tends to be my natural viewpoint. It is a concern for young radiologists, much like it's a concern for young physicians of all fields. They're worried that there's fewer good job opportunities out there, worried about their future ability to not only receive some of the financial benefits of practice ownership, but also losing some of their autonomy and ability to make changes in their own practices. Some of the larger groups will tell you that they are physician run, but ultimately they have to answer to shareholders, investment groups. And so it's hard to truly believe that physicians will have the final say in some of these decisions. So they promise that, and I'm not saying that they're lying, but I'm also not saying that they're not. And so there's that side of it. There's also increasing academic center encroachment on what were traditional community hospitals and traditional avenues where private practices were, flourishing. And now, many of you are probably familiar with entities in your own area that were previously community hospitals that are now quasi-academic or university branded, but not really. And we all know that they're still pretty much community, but with a university brand, and they've now employed a lot of their physicians as well. One of the biggest concerns that young radiologists have is that there's increasing influence of these private equity groups and their membership in the national independent societies. In the American College of Radiology, there's been vigorous debate amongst the members and concern amongst some of the middle age and younger members about the influence of the corporate entities. Some of the senior radiologists who, and I give private equity some credit, they went and bought some of these practices with senior leadership that were tied in to the American College of Radiology, and who had a pretty strong leadership roles in that society. So they went and bought some of these previously independent practices, and those voices are now being used. I would say you can't feel that they're independent anymore. And not only that, but every member of the corporate group is essentially required to be a member of the college, whereas in private practices or in academic practices, you don't have to be, because it's up to you what you do with your CME and your society membership funds. And so they probably have a disproportionate percentage of active membership in these societies that can then influence their voting. And an example of that is in radiology, unlike many other fields, we haven't had as much mid-level involvement, particularly in diagnostic radiology, because they can't interpret exams. But we've had some involvement where PAs and NPs are taught to do procedures, lumbar punctures, thoracentesis, paracentesis, things like that, to help alleviate some of the workload, much like they are used in other specialties for similar similar workload reduction strategies. The American College of Radiology has brought an idea of a radiology specific extender called a radiology assistant. And there's been vigorous debate amongst radiologists seeing what's happened in other specialties where non-physician extenders have usurped and taken over some of what were previously physician roles, and to the physician detriment. And so there's concern about that happening. We saw what happened in anesthesia. We've seen what happens in primary care, where they've taken some practices, reduced the number of physicians, and branched with a larger number of non-physicians who then are under the umbrella of a physician. And so that's a concern to young radiologists, but workloads continue to increase. And so, we don't know what's happening, but I can tell you that just financially speaking, of course, you have to see what's cheaper to employ is non-physicians to do some of the lower physician work, lower in quotes. And of course, if you're an MBA making financial decisions on your spreadsheet, that seems like a no-brainer to you. Well, we all know that it's not just about finances in medicine, and we've made those decisions, and sometimes they don't make financial sense. But when you have shareholders that you have to appease, not just your own medical ethics, those decisions can be a little bit different. So the optimistic future of radiology is that there are more jobs available now because a number of radiologists, whether they're employed by private equity or not, have ridden the bull market and are in much better financial situations than they were 10 years ago. 10 years ago, no one was retiring. Many radiologists were doing 2-3 fellowships in order to get a job, and then they were still not working in their specialties. Currently, the job market is wide open for radiologists. Of course, some of that is because there's a lot more private equity jobs, which are maybe not as desirable, but it just depends on your viewpoint. But there's also just more workload that you all know. Workload has increased for everyone. So there's definitely more need for radiologists. The interesting thing is a study done in the American College of Radiology journal talked about younger radiologists and their view of corporate of radiology. 86% of them believe it harms the field, and 83% of them would rather join an independent practice. So in my mind, that's optimistic, because that hopefully will change the business model in order to make terms either more beneficial for younger physicians in the corporate setting, or maybe they form practices and compete directly with these private equity groups. So traditional private practice also sees this, and they're actually using their independent status as a recruitment tool. So areas are having a hard time filling if they're corporate heavy. I live in Arizona, which is in Phoenix, which is very heavy in the corporate radiology. There's very few non-corporate radiology jobs out here. And Phoenix was a pretty desirable, job market. It always leads the nation in terms of population growth. And so there's always a need, but the sheer number of jobs now, due to the retirements and due to the, at least I think, the lack of desirability of corporate jobs has led them to, I know I've talked to a few people here, I've led them to renegotiate some terms to make them at least more beneficial. But if not, they're having difficulties recruiting. I've been told that by multiple people, both in private equity funded groups and not in private equity groups, that these private equity groups are having a much harder time filling. One of the great things is social media events like this conference, things like podcasts like I did, just physician social media groups and Twitter, whatever. They're getting the information out there to younger physicians who previously there was an information asymmetry between what the private equity executives would tell you and what younger radiologists or physicians who were just worried about training and developing practice skills would have, the information they would have had coming out. So I'm glad we're doing these kind of events to help inform our colleagues to make better decisions. Finally, the most positive thing I can think of is that we've had a 10-year bull market, but investment cycles tend to change, and you never know. Even in this best case scenario where the market has been really good for a long time, the private equity funded groups are still in junk bond or near junk bond status, which means they have to pay relatively high interest rates to get money. The other way to do it is to sell shares, but there may not be as favorable terms unless they can convince people to take future shares instead of actual cash payments to buy their practices. And that's happened to a degree, but they've also had to reach and put big levels of debt. One of the larger groups that I've talked about has debt of approximately 7 to 8 times their annualized earnings. And that's not easy to refinance. And this is in low interest rate era where you can go out and get a 30-year mortgage for under 30%, historically low rates. They're still having to pay 7, 8% on some of that debt. And the only way they make money in the long run is if they're able to refinance that at a lower rate, or convince people to take shares instead. And as we educate these physicians, maybe fewer of them do that. The cycle will turn, and just in general, if the business cycle turns, it may be, and interest rates start increasing, it may be harder for them to fund operations with these kind of in my mind, insane debt burdens, but that's how business is done. So I want to thank the organizers of this conference, Dr. Mitch Lee, for inviting me to speak about radiology. I want to thank the participants, and I want to thank all of you for doing what you're doing, spreading the word. And I encourage you, if you're interested in learning more about the radiology space, take a listen to the podcast I did. Take a look at some of these references that I'll put up here, and just explain to your colleagues, any radiology colleagues that you have, but just in any other field as well, about the facts of private equity in healthcare. Once again, thank you for listening, and feel free to contact me with any questions you may have. My Twitter handle is at Dr. Money Matters, Facebook, Dr. Money Matters, whatever social media you're on, you should be able to find me, and you can check out my podcast as well. Thanks once again, and have a nice day.
Thanks, Dr. Patel. It's a little bit meta because you're kind of here in the comments, but I know working, so in between reads, I imagine. That it really does. I think Dr. McNamara, put it in the comments here that the sellout sort of started in emergency medicine, and we kind of owe the rest of medicine an apology, but it's begun to spread quite a bit to radiology and well beyond that.